Dr. Zoma,
Yes, sir.
thank you for taking the time to visit us here at Belair-Edison's Neighborhood Incorporated. You and I have had a relationship for the past 5 to 6 months, and I definitely welcome your opportunity, your expertise, professionalism, and services that you brought to the residents of this community. Since we are focusing mainly on Minority Mental Health Services Month for July, I just want to ask you some questions about your work, your passion, just to get your feedback and just let us know how you're dedicated to this work. First question is during National Minority Mental Health Awareness Month, there's a focus on disparities in care. How do you tailor your services to address cultural stigma and barriers to mental health treatment within the Belair-Edison community?
All right, thank you so much for this opportunity and answer your question. Chimark Healthcare Services is our practice name, and we have tried so much to meet our people, the people of Edison, Belair, where they are. That is why we chose this environment. We could have started our practice somewhere else. We could have chose another location, but we chose this place so that we could be able to meet our people where they are. Accessibility is one thing that is very paramount to us. So coming to them, knowing them for who they are, and offering them trauma-focused, culturally recognized treatment approach is what we have always been delivering to them, to make sure that every of their needs and problem is addressed in time, and also managing other fallbacks that comes from maybe drug abuse, anxiety, depression, and all that. So knowing who they are, what kind of life they have lived, their family dynamics, culturally, and who they are religious-wise, spiritually wise, who is this individual? So this is what we are here for, and that is our approach, to make sure that Baltimore Edison citizens get the best of what mental health has to offer for them.
Excellent.
Thank you.
Dr. Uzoma, what strategies do you use to ensure your services are accessible to the residents of the community, particularly those facing financial, transportation, and insurance challenges?
Okay. So, like I said earlier, accessibility is paramount. If you have something that I can access it, there's no point having that. So what Chimark does to make sure that this care is very accessible is to make sure that we are having conversations with our individuals that this is what we offer and this is how you can get it. Number one, you are able to meet them where they are, one, and also offer them transportation assessments, knowing, oh, I don't have transportation and all that. You can connect them with or partner with other practices that offer these services. We have community collaborations. We have coordination of care, the case management in the community. And also, we also offer flexible scheduling. So let's say we have our schedule open from 9 to 5. Sometimes we have kids coming in from school from 4:30 p.m. and the office closes by 5 o'clock on the normal. But because of what we know is going on, we have to adjust our time to accommodate. So we have flexible scheduling. We also offer conversation. We do education based on if they don't have insurance coverage. We give them education about how and where to get these coverages from. And also, we also manage and make sure we are following up. Not just giving them that first initial assessment, you have to follow up and make sure that whatever intervention you're working on or you are advising or prescribing is actually being utilized. So not only giving the treatment, we are doing follow-ups, we are offering care coordination, we are giving family intervention, we are offering other things like education and psycho-education, also explaining to them why they are going through what they are going through and how to get out of it.
Understood.
So that is how we do it. We do flexible scheduling, and we make sure that timing and everything is not a barrier for that.
Okay.
Yeah.
Perfect. There are some providers on the business quarter who offer holistic and community-based services. How do you integrate mental health care with broader supports like housing, employment, and family services?
Okay. So like I said, we are always in tune with the community. We know that this problem, transportation, housing, if I'm mentally ill, I can manage my housing. I can be stably right with anything. So that way, we need to do our proper assessment, know what the problem is. What is, because no two individual is the same. Mm-hmm. My problem for housing might be I don't have money to pay rent. Mm-hmm. Somebody else's problem is not because of rent, it's because maybe they cannot manage or put the house in order. Mm-hmm. So you have to actually recognize what is the particular problem with the individual. Housing, you collaborate with housing resources. There's a lot of housing resources. You have to make sure you are putting them and pointing them to the right direction, where to get the resources they need, where to get the family intervention, like early intervention for children, family support, because if a mother, for instance, is going through crisis with her child and you are managing this child as a patient, you also have to manage the mother too. Mm-hmm. Because if without doing that, it's not going to be in sync, and the treatment plan or whatever intervention you're offering is not going to be assimilated well. So in that case, you have to know what and how you can also collaborate with every wholesome care of this individual.
Mm.
Yes.
Good response. Next, trust can be a major factor in seeking care, as you know. How do you build and maintain trust with individuals and families within the community?
Well, trust is something that is very, very, very precious, priceless. So how we do it is to be ourselves, to be who we are, to be consistent. Mm-hmm. We are consistent. You have to build that trust. You have to be consistent with it. You have to also make sure you are there. When you say you're going to be there, you're there. Mm-hmm. Okay? And also you have to listen to understand, not listen to judge. You have to provide. Chimark Healthcare Services already provided a safe environment, a welcoming environment, whereby somebody can walk in and feel like, oh, this place feels warm. And then sitting down, you got to understand and listen to them. Let them speak what they are going through. And while you are listening, you are also not judging them. Right. Because the stigma is a part of the problem why people do not seek mental health treatment in time. They are afraid that their fears will be out there. People are going to talk about it. So you need to ensure that you are telling them and showing them that their problem is not going to be a topic of discussion. Mm-hmm. You're going to show them that you're going to be there for them and offer them that professional help that they need in time too. So consistency, building trust, and also offering them psychoeducation that is culturally and trauma-focused intervention. Okay.
Yes. Dr. Zoma, what approaches have been most effective in engaging youth and families in mental health services within the community?
Okay. The youth are always the tricky ones. Mm-hmm. They come in and then you ask them, what's going on? Nothing. Why are you here? Nothing. But let me tell you, it's a lot going on in their mind. They are dealing with school stress. They are dealing with family responsibility. They are dealing with social pressure. They are dealing with their own inter and intrapersonal relationship also. Mm-hmm. So you have to understand that these youths speak through their behaviors. Mm-hmm. When you see a child expressing anger or throwing things, this is this child telling you, I'm not comfortable. You don't just treat the behavior, you find out what the problem is. Mm-hmm. So these youth, when they come in, we'll give them a very good space where they can feel welcomed, loved, and understood. And there you build your trust, and from building that trust, you gotta be consistent, because if you do 8 today, you gotta do 8 tomorrow, because that's the only way they can understand you. And not only that, you have to work in sync with the family. You have to work with the family members. You have to work with the community where they are coming from. Understand what is going on with them. And also the school system are not left up in this. Because now, these youths in school, they are dealing with all the stigmas from school, maybe their body weight, self-esteem issues and all that. These are things we have to build trust first with the youths, and then consistencies, and then teach them, and then that is the only way they can believe what you're telling them, take this medication or do this intervention or therapy, whatever you're offering them, they can better understand and comprehend what you're trying to give them. And that's the only way they can even comply with the treatment intervention that you're offering them. So that being said, don't just listen to what they say. Their behavior speaks louder, because their behavior is a way of you knowing that this individual is going through a lot of stress, and that's where the answer lies.
Perfect. And finally, Dr. Zuma, from your experience, what are the most pressing mental health needs within the community today? And where do you see gaps that still need to be addressed?
Okay. I see a lot of gaps in people have lost trust in our healthcare system. They don't trust the healthcare system to protect them. There's a lot of gaps in the social services that we offer them. Housing. A lot of these individuals are coming out from the prison, have been incarcerated for years. They don't know where to start. Mm-hmm. They're just looking at the whole environment. Where do I start? They'll feel like they don't belong. But this is where they came from. This is where they are being born from. And this is the community that can be used also to heal them too. So what I see problem that still exists and needs to be addressed is accessibility of care. A lot of individuals don't have access to care. Mm-hmm. Even when there's a lot of mental health clinics around, they don't think it's for them. Mm-hmm. So now there's a barrier whereby they feel stigmatized. Mm-hmm. They don't think that they're gonna judge me. Oh, I did drugs. Oh, I'm depressed. Oh, I have anxiety. Oh, this and that. So anxiety and all that are issues that needs to be addressed on time. Healthcare providers and the government should recognize this problem, offer to meet these people where they are, like we are here in this community, offer them accessible care, make sure they have coverages, insurance coverages, or even some kind of treatment they can afford. And then offer them a healthy environment that will enable them to come and speak freely without feeling like, oh, they are being judged. Mm-hmm. So accessibility of care, transportation, and housing it can never, like I was talking to one of the social services officer the other day. They are telling me that they have a backlog of application down to 20. Even the patient I'm even applying for, that he's not going to get until 2032. You can imagine that alone even put me into depression. Because how can someone wait till 2032 to be able to assess housing need and assistance? So housing is part of the problem, finances and employment, and also dealing with other external and environmental issues like crimes, substance abuse, depression, and all that. These are things we need to address, and that still needs help. So we need more mental health providers. We need more trauma-focused providers that understand that most of this behavior, the crime, the killing, and the drugs and all that, does not come from anywhere but unresolved problems that are still sitting and looking at us in the face every day. So this is something that we still need help with.
As we conclude, can you provide some brief closing remarks?
Okay, thank you so much, Mr. Stein. I mean, who am I that I've been summoned here by the delectable man, you know? So my closing remarks on this is, I am a mental health provider who has and will continue to make herself available to the community. You know, I'm not perfect, but I'm trying. I'm gonna be well. I'm gonna try to put myself in a place where I can be that for you, some kind of help. We're gonna walk through this together. Like my motto always says, come, let us heal our minds together. You're healing me, I'm healing you. Because I'm sitting down there taking that and asking you questions doesn't mean I cannot learn from you. So wherever you are, however you think you have been, come, we're gonna find a place for you. This is spot for everyone. Thank you.
And with that, thank you.
Thank you.
And where are you located?
We are located at number 3337 Belair Road off by Edmond Avenue, and that's where we are.
And what number is best to reach you guys?
Our number is 443-815-8003, and that's our number. You can call us anytime and we will be able to service you. Thank you so much. Thank you.
Yeah.
Thank you so much.
You're